Who is making those decisions?
So
not what are the decisions, but who is making them?
Right,
You, Doge, OMB, someone else?
Because there's a range, there's the different answer for some of those. So
Okay, so all of the above?
well, no, not necessarily. It depends on the specifics we're talking about. So if I may, so there's change in priorities for the NIH to move away from politicized science. I've made those decisions.
We are back with the big deal. That was the director of the National Institutes of Health, Dr. Jay Bhattacharya, appearing before a Senate committee earlier this week, where he defended a proposed $18 billion slashing of his own agency's budget. That accounts for about 40% of the agency's current funding. Under the Trump administration, the NIH has terminated nearly 1,400 research grants, and another 1,000 projects have been delayed. We are already seeing the effects on medical research, with the cuts potentially delaying progress in areas including research to find cures for Alzheimer's, substance abuse, and cancer. Scientific professional organizations and advocacy groups are sounding the alarm about the toll all of these cuts will take. Spectrum News political reporter Erin Kelly has more in this report.
President Donald Trump is proposing a more than 26% cut to the budget of the Department of Health and Human Services, a move cancer advocacy groups say would be devastating to the fight against the disease. In March, HHS announced it would reduce its workforce by 20,000 employees, part of a dramatic restructuring that it said would save $1.8 billion. Galen Hayden, a breast cancer survivor, heads Book for Hope, a nonprofit that supports the families of more than 120 children battling cancer, most in Kentucky. Among them, 11-year-old Aubrey Avery, who died from brain cancer in May.
You might not have a child with cancer. Your neighbor might not have one. But I promise you, every elementary school is going to have a child come through with cancer.
The organization also funds pediatric cancer research, like the work of Dr. John Prenzner, a pediatric oncologist and clinical research scientist at the University of Michigan.
We are seeing tremendous improvements over the last 20 years. So the message I would give to anyone in Congress on both sides of the aisle is that this is one of the best investments we can do as a country.
Prenzner's research is also funded by HHS's National Institutes of Health. And while he says he hasn't faced cuts so far, some of his grant funding applications have faced administrative delays. And he's concerned about ongoing and future cuts to cancer research.
What I'm concerned about is the ability to go down to families and say that we can give you the very best, the very newest, and the greatest hope for cure. I'm concerned that we won't be able to make those statements in the future in the same way.
An HHS spokesperson told Spectrum News in a statement, quote, HHS remains committed to advancing cancer research and other serious health conditions. These areas continue to be high priorities for both NIH and HHS. Ongoing investments reflect our dedication to addressing both urgent and long-term health challenges. In Washington, Erin Kelly, Spectrum News.
Joining me now with more is Dr. Harold Varmus, the former director of the National Institutes of Health and the National Cancer Institute. He's a winner of the 1989 Nobel Prize in Medicine for the discovery of cancer genes. And Doctor, in a recent opinion article that you wrote about this, you said, and I'm quoting here, "This is a time to reflect on the marvels of science in which America has played a leading role. If the attacks on our scientists and their institutions are allowed to continue, our envisioned future of longer, healthier lives will happen more slowly in other countries or not at all." From your knowledge, Doctor, what kinds of medical research grants is the Trump administration targeting?
Well, it's targeting, as your report succinctly indicates, science across the board, and emphasizing, of course, one of the diseases we're most concerned about, which is cancer, but also affecting virtually every disease that is being studied by the 27 institutes and centers at the National Institutes of Health. Moreover, it's cutting off training. It's sending a signal that science is not a desired activity of the U.S. and its government. It's breaking a tradition that dates back to the 1940s, when the federal government began to support research at our universities throughout the country. This is tragic, because we're not trying to make America great again under Mr. Trump. We're undoing the greatest things that the country has done.
Yeah, I mean, scientific breakthroughs won the war, literally the Second World War, right?
That's correct.
In addition to disease prevention, which we certainly care a lot about, but you've also written that, moving away from science actually could damage the overall economy, right?
Absolutely. The money invested in the NIH has major returns to commercial entities and to the public, and that's been well documented by economists for years.
This week, more than 300 officials at the NIH, your old outfit, signed a letter called the Bethesda Declaration. It's addressed to the current director of the National Institutes of Health, and it condemns the changes at the agency and what they're calling the politicization of research and the destruction of scientific progress. It's not every day that we see that kind of open resistance by government employees, but do we know if the administration is listening?
Well, it's a little hard to say. I know that not all of these directives come from the new director of NIH himself. They come from above, from his boss at the Department of Health and Human Services and from his higher boss in the White House. And in my view, these are destructive tactics that are undermining the future of the country because among the things that are being done, it's not simply the deprivation of funds for research, but also signals that or directives that prevent people from abroad to come here to do research. One of the things that's been remarkably successful over the last several decades is the way in which America has been a magnet attracting the smartest people from all over the world to come to the U.S. and do their best research and contribute to our nation's and the world's good health.
You also said in that recent op-ed articles that everyday Americans, including a lot of our viewers who are watching right now, need to get involved. What do you think they should do?
Well, they need to say that they're distressed by this and that they have aspirations for the country's traditional contributions to the research that fundamentally changes our perception of how organisms work, contributes to basic biology, and that leads to, over the long run, the development of the kinds of new therapies we now have for genetic diseases, for cancers, for infectious diseases. These are remarkable advances that were unimaginable 20, 30, 40 years ago. And America is justly proud and widely respected for these things. Do we really want to go back to a time when America is waiting for other countries to be scientifically astute? No, we want to be doing that ourselves, and we have shown that when the country is working together in a humanitarian and an enlightened way, that we make tremendous contributions to the welfare of the world.
Okay, we will continue to follow this story. Thank you very much, Dr. Varmus. Great talking with you.
My pleasure. Thanks for covering this.
Thank you for watching our YouTube channel. Let Spectrum News be your resource for balanced, in-depth political coverage, and click the subscribe button right here. You can also download our app or watch us on TV to learn more about the candidates, where they stand on the issues, and more. We'll see you then.